Good afternoon. My name is Samantha White, and this is my presentation on autism spectrum disorder. I do apologize in advance. I am recording my computer from my phone. I was attempting to use Zoom. It was supposed to be recording, but every time I checked the cloud recordings, there was nothing on there. Not sure what happened, so I'm just kind of winging it. And then another disclaimer, I am almost certain I have COVID. I have not been tested yet, so I will try my hardest not to cough and hack throughout this video, but I can't make any promises, and I do apologize if that does occur. With that being said, let's go ahead and get started. So what is autism spectrum disorder? According to the CDC, autism spectrum disorder is a developmental disability caused by differences in the brain. Some people with autism spectrum disorder have a known difference, such as a genetic condition or like gene mutations, things like that. Other causes are not yet known. What are some of the signs and symptoms of autism? So please understand this is not an exhaustive list, and autism affects everyone differently. So some people may have a lack of social skills, and some may not. It affects everyone differently. These are just the most common signs and symptoms of autism, but again, it's not an exhaustive list. So many children will lack social skills. They don't make eye contact or they avoid it. They don't respond to their name by 9 months of age. Some people will mistake their children for being deaf because they're not responding to them when they're called. They don't notice or try and interact with other children by the age of 36 months. A lot of children will exhibit repetitive behaviors and restricted interests, so they will line toys up or other items and become distressed or upset if that line is broken. Many children need to follow a very strict routine, and they become upset if there is even minor changes in said routine. Some of the repetitive behaviors can include flapping their hands, spinning in circles, rocking their body, etc. They may have sensory issues and react differently to strong smells, sounds. They may dislike certain textures of foods, clothing, things like that. Other signs and symptoms of autism can include delayed language skills, cognitive delay, excessive fear or worry, or the absence of fear or worry. So sometimes these children don't seem to understand danger. They might run in front of cars or elope, meaning that they will run away with not realizing that it can be dangerous. All right, so the autism spectrum. So autism is a spectrum. That means that autism affects each individual differently. For instance, one individual with autism may have high sensory needs, but will have less trouble in social settings, where someone else who may have more trouble in social settings and be more sensitive to sensory input. We used to view autism on a sliding scale, so one would be your less autistic or high functioning, and the other would be more autistic or considered low functioning, is what we used to call that. We now view autism more as a color wheel, and like the one shown right here. Each individual's wheel will look different. So some people have very little social difficulty, while other people may have more. Some people, again, will have very high rates of anxiety. Some people might have moderate. It really depends. So each person's wheel will look different. Some people don't need as much routine, where others may, etc. That's just another way of looking at autism. What are the causes and risk factors of autism? So according to the Mayo Clinic, autism spectrum disorder has no single known cause. Given the complexity of the disorder, the fact that symptoms and severity vary, there are probably many causes. Both genetics and every environment play a role. While there does not seem to be a known cause, there are several risk factors for autism. These can include, but are not limited to, genetic disorders such as Fragile X and Rett syndrome, and mutations within certain genes. Having a parent or sibling with autism puts your next child at greater risk for having autism. Low birth weight, parents being older at time of conception or birth. And possible environmental factors such as infections, pregnancy complications, etc. I'm sure many of us have heard that vaccines cause autism. That has been debunked. Vaccines do not cause autism. Please vaccinate your children. Demographics. According to the World Health Organization, it is estimated that 1 in 100 children will be diagnosed with autism worldwide, though some studies show that these rates could be much higher. In countries with middle to low income, there is hardly any data, which makes it more difficult to obtain accurate numbers. The CDC, states that in the U.S. alone, 1 in 36 children are diagnosed with autism per year. So that's a pretty big chunk of our population. In the past, Caucasian children were more likely to be diagnosed with autism than Black or Hispanic children. But with outreach efforts for minority children to receive screenings, this gap has significantly closed. Some reasons why minority children might not be receiving screenings could be economic factors. Maybe the parents lack transportation, or they can't afford like bus tickets, things like that, to get them to the doctor. There may be lack of access to medical care. So I know in my town, I live in a very rural area, and there's only a few health clinics. They're quite far away. And because there are only a couple of health clinics that we have, a lot of times appointments are booked out for months. So some people unfortunately go without care. Another thing could be cultural differences and beliefs regarding mental health. Again, this is not an exhaustive list. Everybody has their reasons. These are just a few examples of why someone might not get diagnosed with autism or get screened. Prognosis. Because autism affects individuals differently, it is difficult to give a prognosis. Factors that affect prognosis can be the severity of effect on the individual, the age of diagnosis. So early intervention, they're always talking about early intervention, and that's because the earlier you can get a diagnosis and get intervention services, the better the outcome. And again, age at intervention services, where the intervention services were started, and even the quality of intervention. So just because you put your child in intervention program, I mean, if it's not a great intervention program, they're not using up-to-date information, they're using outdated practices, or it's not data-driven, then they might not be getting the care that they need, and the outcome might be not what you want. While many individuals with autism require minimal support and are able to function relatively normally, and I do hate using that word, but for lack of a better word, that's what we're going to use here. Others may need lifelong care, while some other people may need medium levels of support. If your loved one has been diagnosed with autism, it is important to seek help from a qualified professional who can provide referrals for intervention services. And again, the earlier the intervention begins, the better results, though they still may differ between individuals depending on the severity and what have you. How can recreation therapy help individuals diagnosed with autism? Many children with autism have difficulty making friends and relating to their peers. Because of this, I would recommend activities that can help develop these skills. This can include board games or other turn-taking games, sports activities where cooperation is needed, etc. Depending on the individual's level of tolerance to group settings, goals can be simple, such as having the child engage in parallel play for a set amount of time and slowly increasing that time. And eventually leading up to peer play, where they're actually interacting with their peers, not just parallel to them. Once the child has mastered peer play with a single peer, more peers can be added. This can help teach valuable social skills and allows children to make friends. Other interventions to build social skills can be small outings, such as public parks, going to the store and just learning how to shop and be exposed to the different sights and smells within a store, going to a restaurant to help children become more used to being in public and teach them social norms. Again, this is just one example of how recreation therapy can help children with autism. It's not an exhaustive list. And here is my reference page. I thank you very much for watching. Have a great night.